Dear WeGO members, partners, and friends from around the world, welcome to the 2021 WeGO Smart Health Responder webinar series, part 4. Good afternoon from sunny Seoul, and good morning and good evening to all of you, depending on where you're joining us from. The webinar today saw the highest number of registrations since we started this webinar series. More than 180 people from various regions have registered, and we hope that most of them can join us live today. Welcome once again. Allow me now to invite Mr. Kyung-Yeol Lee, Secretary General of WeGO, to deliver his welcome address on the occasion of today's webinar. Mr. Lee, welcome.
Thank you. Good morning. How are you, WeGO friends? First, I hope everyone is healthy and happy. We're living in a very extraordinary time. The most recent statistics about COVID-19 is 128 million confirmed cases, with about 2.8 million deaths. It's one of the 10 deadliest pandemics in human history. Well, with the advent of vaccines, we hope this year will be different. As of now, we have 12 authorized vaccines, and over 540 million people were already administered. Nearly all the world population will be vaccinated by the end of this year. We want ordinary times to come back, and I believe it will from the late second half of this year. When it does, we'll be able to relish our life like never before. Due to widespread lockdowns and travel limitations, our physical living space has shrunk, but our virtual living space has expanded. Digital online activities have grown exponentially. And I guess the new way of living will not disappear even after the virus is gone. It's because the new horizon of the virtual living space has opened a new source of comfort, opportunity, and well-being. COVID-19 has also testified that smart technology and digitalization of government is the key to fast and efficient solution to problems. Increasing number of cities are pursuing to be smart. That's why new members didn't stop joining our organization despite the hardship. About 30 cities and companies became our new members last year alone. WeGO adapted to the new situation very swiftly. We launched the Smart Health Responder program early last year. At the same time, we inaugurated the Smart City Driver program, which helps you to design your ideal smart city online. The Smart Health Responder is a platform where we share what we do about coronavirus, namely 3 Ps: precaution, prevention, and preparation. The 3 webinars we had last year focused on best practices for precaution and prevention. Now we turn to preparation stage. What do we do? What do we have to do to live better in post-COVID time? Better management of air and water quality, and new way of healthcare and smart tourism are some of the important topics for our attention. Today, we focus on Europe, Middle East, and Africa region. It's because the region encountered huge challenges and probably therefore has seen prominent examples of success as well. I hope we can share the regional cases of innovative solutions. I welcome you to the session, and I wish you 10,000 happiness. Thank you very much.
Thank you, Mr. Lee. Now, please allow me to give the floor to Honorable Abdullahi Adamu Candido, Executive Chairman of the Abuja Municipal Area Council. Last month, WeGO celebrated the launch of its newest WeGO Africa Regional Office with a host city in Abuja, Nigeria. We are more than excited to collaborate with a growing number of partners in Africa. Honorable Chairman Candido will deliver his remarks in the following pre-recorded video.
All to the 2021 WeGO Health Responder webinar. the COVID-19 pandemic began to transform the global health world at an exponential speed. Look at how quickly we were able to get vaccines, which may not have been possible without recent technological innovation. Institutions and governments have had to accept the use of digital health technologies quicker than usual. The importance of the use of data to provide health solutions cannot be overemphasized, and the need for governments to institutionalize health systems is clearer than ever before. I'm excited to have this conversation continue more consistently at this second Health Responder webinar. Globally, many have risen to the challenge, developing solutions that have provided technology-enabled care, TEC, among others, past year. There is enormous potential expected to produce cost-effective solutions across the healthcare sector, and we look forward to being part of more impactful growth via this series of webinars. Once again, welcome.
Once again, thank you to Honorable Chairman Candido and our colleagues in Abuja for the kind greeting. Welcome once again on behalf of WeGO. My name is Todor, Smart Health and Corporate Partnerships Officer in the WeGO Secretariat, and I will guide you through today's program. Before we continue, let me remind you once again that the webinar has 4 interpretation channels with an original audio language in English. You can select an audio channel in Mandarin, French, Korean, and Russian. Please make sure that you have updated Zoom to the latest version in order to access the interpretation. You can click on the globe icon on the bottom right part of your screen and select the audio channel of your choice. You can also select to mute the original English audio and listen only to the language of interpretation. For any technical issues, please write a comment in the chat box and our technical team will do their best to assist you. Also, kindly use the rename function to change your name to your full name and your affiliation in brackets. We would also like to ask you to turn off your cameras and microphones unless you're one of the speakers in today's event. You can use the chat box also to address your questions to the speaker, and we'll make sure to address them to the speakers during the Q&A session in the panel discussion later in the webinar. Today's webinar will be recorded with its original audio in English, and you will be able to access the recording, including the presentation materials, after the event through the WeGO webpage. Now we'll proceed with a brief introduction of WeGO. The World Smart Sustainable Cities Organization, or WeGO for short, is a membership-based international association of local governments, smart tech solution providers, and national and regional institutions. WeGO is committed to the transformation of cities into smart sustainable cities by serving as a global platform to foster international exchange, cooperation, and networking among members and partners. Founded by 50 cities in 2010, WeGO currently has 210 members. The majority of them are cities and local governments, while the number of institutional and corporate members is continuously growing. WeGo's activities can be divided into 4 main categories: knowledge sharing and networking, capacity building, project implementation, and knowledge building and research. For more information on WeGO and its activities, please visit our webpage where you can easily access our latest publications. Also, feel free to contact us via email about our programs. The WeGO Smart Health Responder is one of the flagship programs of WeGO and was launched in early 2020 in response to the COVID-19 pandemic. This year, the scope of the program expanded to include 3 main components: Data Portal, Knowledge Hub, and Smart Health Assistance. The Data Portal provides statistics on public health and related ICT indicators, while the Knowledge Hub is the home for webinars, workshops, and discussions on best practice in public health emergency policy. Finally, Smart Health Assistance connects cities with suppliers of medical equipment and health-related ICT solutions. As part of the Knowledge Hub component, WeGO launched the Smart Health Responder webinar series in 2020 with 3 installments. Part 1 focused on the Asia-Pacific region, sharing best practices and advice from the medical community. Part 2 expanded our reach to the Americas to explore the effects of the pandemic and analyze relevant policies of cities in the region. Part 3 was conducted during the annual WeGO Executive Committee meeting in 2020. and broke new ground on holding a global discussion with participants by launching an international video submission contest on the topic Reconnection in the New Reality. This brings us to the newest edition of the webinar series with today's part 4 on the topic Smart Technologies for the Next Normal, exploring the context of solutions in Europe, the Middle East, and Africa. The event will include 2 sessions and a panel discussion with guest speakers and participants, and will help us understand various perspectives of dealing with the pandemic in the dynamic climate of current affairs in those regions. Session 1 of today's webinar is dedicated to the COVID-19 response across various fields. Cities and countries in Europe, the Middle East, and Africa have prominent examples of COVID-19 response, including currently ongoing successful vaccination programs, solutions for traveling with the help of digital technology, and policies to ensure the safety of citizens. At the same time, however, the region is presented with various challenges due to the recent surge of new confirmed cases, spread of new strands of the virus, and various setbacks in containing the pandemic. Our speakers today will share their expertise on policies and solutions related to COVID-19 response with the help of digital technology, while bringing us together around a virtual table to think about what we can do collectively to leverage our efforts in shaping the next normal. I'm reminding all speakers that the presentation slides will be operated by our technical team, so please instruct us to change the slides by saying next when necessary. I'm now delighted to invite our first main speaker for today, Professor George Crooks, CEO of the Scotland Digital Health and Care Innovation Centre. Professor Crooks is not only in the heart of digital innovation for health in Scotland, but is also heavily involved in the digital health sector across various European institutions and committees, while advising national governments and working together with prominent international organizations for digital innovation in healthcare. I'm very excited to welcome Professor Crooks and looking forward to the presentation. Professor, if you hear me, you can have the floor.
Thank you. Thank you very much indeed. And thank you everyone for giving up your time to be here today. And if I can have my first slide, we can move forward. Thank you. Okay, next. Next slide, please. This is our headquarters, which is in Glasgow, and Glasgow is experiencing exactly the same issues and challenges as everyone else around the world. Next slide. Globally, we are all in this together, but what I'd like to do is not to reflect on the past year or 16 months, but actually to begin to look further forward. Next slide, please. So, what are the facts? What is it that's facing us in the months and years ahead? Next slide. Well, as you've heard, coronavirus is not going to disappear later this year. It's going to be with us for the whole of our lives and generations to come. The challenge is how we adapt to live with this virus circulating in our community. And vaccination is an important part of that, but it's not the only thing we need to manage, because the challenges of increasing demand on health and care and public services over the coming months and years are going to pose significant challenges for cities, regions, and for national governments. Next slide, please. All that is in the concept of a world that we were living in pre-COVID, which was showing that public sector services were becoming increasingly expensive to deliver. The cost of healthcare was rising exponentially, and as a percentage of gross domestic product was really getting to a level that most countries were finding difficult to continue to manage. And therefore, there was a recognition that we had to transform the way we're delivering health and care services so they could be sustainable into the long term. Next slide. We were also faced with an aging population and the challenges about how we keep our aging population actively involved and engaged within their own communities and productive for more of their lives. Next slide, please. And finally, the challenge to us all that is much greater than the public health threat of coronavirus can ever be, that of global warming. And we are all now facing the challenge of how we move towards a net zero carbon dioxide emitting economy. Is it possible to do all those things together? Next slide, please. Well, this isn't the vaccination slide, this is the injection of reality. The answer is yes, if we're smart and if we collaborate and plan together. Next slide, please. Because the one thing coronavirus has done for us is it's forced us to think digital. Next slide, please. The use of digital technologies have come ubiquitous in the way we run our day-to-day life. It's the way we've been meeting together as families and with friends. It's the way in a lot of countries and communities we've been doing our shopping, that we've been engaging in work. So how do we take the advantage that using digital solutions in a ubiquitous way within our personal, social, and commercial life into the health and care environment and into how we're going to deliver public services? Next slide, please. So for me, it's not simply saying, let's carry on as we're doing. We need, as planners, to look at what next generation services are going to look like and what they can do for us. Next slide, please. We need to stop thinking about products and we need to start thinking about services. Next slide, please. So what I'd like to do is to focus on the health and care example. Up until now, the vast majority of our time, effort, and spend has been on treatment and post-event care, with very little attention to prevention and detection and to independent living. Next slide, please. And if you could click again. What we need to do is we need to focus more of our time on prevention and detection and independent living. Next slide, please. And to do that, we need to use Industry 4.0 tools and services that have been used in the manufacturing industry, for example, car manufacturing, for many years. But what we don't want to do is to simply look at our institutions as factories. And in this case, what a lot of healthcare systems are doing is they're taking the hospital and thinking it's a factory and taking the healthcare pathways and just turning them into more efficient ways of doing the same thing. That will give you short-term gain, but isn't going to give you long-term sustainability. Next slide, please. Because the reality is, we've always focused in the past on institutions, organizations, and buildings. Next slide, please. We need to use digital tools and services and technologies to strengthen people's connectivity to their families, to their communities, be they geographical communities or creating virtual communities of interest and care. That's the key to success. Next slide, please. So how do we do that? Well, the first thing we do is we need to understand that the spend that we put into public services and into health and care, we in the past have regarded as cost. And the thing that most people do when they're under pressure, when you look at cost, is you try to cut it. That's the wrong attitude moving forward. We need to look at investment into public services and health and care in particular, not as cost, but as investment. And the thing with investment is you can actually address the societal challenges within health and care and the needs of citizens, and at the same time create economic advantage. You can empower and encourage local businesses to develop tools and services to address your local and city needs, but at the same time develop products that can then be sold internationally and therefore grow the local economy. Next slide, please. So what is our future? What's it all about? Next slide, please. For me, it's all about the citizen. We need to put the citizen at the heart of everything we do. And I know that you'll be doing this from a planning point of view within your cities. But the challenge I'm going to give to you is, what if the citizen became the point of data integration? What if we stopped investing millions of dollars, pounds sterling, and euros in creating artificial intelligence and machine learning solutions that we put in the hands of government departments, local authorities, and large organizations? But we make trusted artificial intelligence available to individual citizens to work on their own data, to allow them to make better health and well-being choices, to allow them to access public services on their own terms. And rather than be consumers of health and care and public services, they're active participants and partners in delivering those public services. That's a different way of thinking. Next slide, please. So in the health care arena, some of you will recognize this slide. The inside of this pie chart are the social determinants of health. We know that as well as genetics, our individual health and well-being are influenced by a number of factors. In fact, and it may be a surprise to you, that only 20% of your health and well-being is determined by the activities of the formal health and care services within your cities and countries. 30% is down to personal behavior, your eating habits, smoking, drinking, exercise or lack of it, 10% down to housing, and 44% down to social and economic and other environmental factors. What we did in DHI in Scotland is we mapped the easily identifiable data points that we can pick up on our citizens, and we matched those to the social determinants. And this is replicated across the world. And what we found is that we are making life and death decisions on you and I and my family and your neighbors based on about 16% of the available data. Because the only data a health and care system trusts at the moment is the data it generates itself. Whereas if we can blend consumer-generated data with formal public health and formal healthcare data and other data collected and sitting in your databases, we can get a better understanding of the lived experience of individuals. Therefore, we can plan services better, and we can also manage health and care better. Next slide, please. And therefore, citizen-centered data sharing is fundamental to the future. Next slide. Simply having a luxury bathroom in your house with lovely taps doesn't mean you're going to get hot water. Next slide. So what I want you to think about is, what is your ICT architecture going to be of the future? Because something as boring and mundane, you may think, and you leave to your technologists to sort out, can be really empowering if you design it in the right way. It allows people to do the right thing and to allow data to flow with the full consent and understanding of citizens. Next slide, please. And that allows us to transfer health as the spend agenda, as I said, to the wealth creation agenda. Next slide. And that's what we've been doing in Scotland. We've been creating an fertile environment in communities where people live to allow businesses to work with academia and public services to create new innovative solutions. Next slide, please. But we recognize we can do that, but at the same time, for local government, for regional and national government, they want their technology within a walled garden where everything is ordered and structured and safe. How can the two live together? Next slide, please. What we did is we went around the world and we talked to the architects who built some of the most advanced systems. And rather than going to Singapore or to Finland and saying, we want to buy what you have, we asked the architects, what would you do differently? And we built that. And that's the platform that we use in Scotland to deploy all our coronavirus services. It's based on a data exchange layer that allows us to blend consumer-generated data with formal health and care data. So we can take data from a wearable device on your wrist, a smart sensor in your home, and we can actually ship that securely and in a trustworthy way into either the electronic health record, the primary care family doctor record, or into public sector databases. And equally, we can lift data from there and we can put it into a personal held citizen file, empowering the citizen to take more responsibility and to act on trusted information. Next slide, please. So we are focusing on that personal integration box in the center. What that allows is public service systems to continue to grow and develop slowly, which they will do. But equally and more importantly, it allows innovation to happen out there in the consumer environment. Next slide, please. I just want to finish off with this thought. Although I've talked a fair bit about technology, it's really not about technology. Next slide, please. It's all about citizens. If we develop new digital tools and services in a smart and intelligent way, we can empower our citizens to actively participate and deliver more of their services, irrespective of their age, irrespective of their intellectual capacity, and irrespective of whether they're the most advantaged or disadvantaged in society. It all comes down to user-centered design. Thank you very much indeed.
Thank you very much, Professor Crooks, for the insightful presentation and for providing us with a perspective of not only the present, but also the future, and putting the citizens in the center of this, this whole concept of health, data, and citizen management within a community. So thank you once again, and looking forward to having you in the upcoming panel discussion. It is now my pleasure to present to you our next speaker, Ms. Nadine Bourbar, Deputy Chief Resilience Officer in Ramallah City. As one of our very active city members, Ramallah City has been eager to work with WeGO on various projects, including WeGO's flagship platform for smart city project development, the Smart City Driver. Today, Ms. Bourbar will share with us Ramallah City's response to the COVID-19 pandemic through the following pre-recorded presentation.
Good morning, everyone. Good afternoon. It's a pleasure to be with you today to present the measures of Ramallah City over COVID-19 pandemic. Before I go into presenting the measures, I would like to give a very quick overview about the city of Ramallah. So the city is located in the West Bank, 15 kilometers north of Jerusalem. The city was founded in 1908, and now it's inhabited by almost 72,000 people. And during the day, this number goes up to 300,000 people, as Ramallah is the center for economic, administrative services, and recreational services in Palestine. In 2017, we developed our comprehensive urban resilience strategy, which aimed at better management and practices over crises and disasters, which that would be regarding the 21st century challenges or any daily or sudden shocks or stresses. In regards to COVID measures and pandemic in Palestine and in Ramallah specifically, we see that this year in March 2021, the virus became more severe and more contagious because of the new variants as well. Ramallah and Palestine entered the third wave of the virus. We had a higher number of occupancy rate in hospitals, which is still ongoing until now, higher mortality rate. And we've started with the vaccination plan, but still in lieu with containment measures because there's not enough vaccination arriving to Palestine in comparison to the number of people that needs to get the vaccine. So going to our urban resilience management of crisis that we followed in our response to COVID, we followed the urban resilience framework that you can see on the right of the screen, which is built on 4 major pillars: the leadership and the strategy, health and well-being, economy and society, infrastructure and environment. And this framework tells us how our practices and plans should be integrated, and that they should be cross-cutting. So we see that in times of health crisis such as COVID, we need good leadership and good strategy in order to have better health condition, better economy, better society with a better physical and mental health, and of course the infrastructure and environment to be maintained and sustainable at the same time. So these are the instant actions that were taken by the city of Ramallah upon the outbreak of the virus in the city. We've had an emergency plan, and we immediately developed emergency rooms. The emergency rooms were developed and managed through our GIS platform system in the city. We divided the city into 21 neighborhoods in order to analyze and manage each zone in the city individually, and also to oversee the management of services, delivery, the inquiries coming from organizations and local community in times of crisis. And also in the screen, you can see other instant measures that we've taken upon the outbreak of the virus. So our role as a local authority that is on the front line with the people, we needed to provide people with adequate information, especially at the beginning when there was not enough credible or enough information the first 2 months or 3 months of the virus, we needed to support the ecosystem of credible information by partnering with healthcare partners and officials, and most importantly, to build an online community of credible sources of information. So you can see from the graph the number of information that reached the people on our platforms. And that also continues until now, because now we are entering into a different phases of ambiguity, I would say, about the vaccine itself, about what to do after the vaccine, or what comes next. So that is important to deploy technology into the purpose of trust building, credibility, and for collecting data to manage our services or to manage our plans. So we depended on e-payments and e-services during the lockdown, during the emergency state that we still have until now since last year. And that's by digitizing our services, by depending on online procurement support to the municipality and to the organization, and also by depending on online surveying to understand the needs of the people. So these are just very quick examples of how we deploy the online surveying to reach the people and integrate them into our social and cultural activities, because we were determined that culture and social activities should remain a right for people to exercise even during critical times. So here you can see that we ask people to fill in online surveying to participate in different activities, and this one that we provided them with plants to their doorstep that they can use as a home activity during lockdown or whenever. And this is an example of a survey to understand people's needs during crisis, or suggestion of how to manage certain situations. So they also filled in the survey, and we tried to understand what is the community feeling and what are their thoughts on management of certain situations. So in a nutshell, these are the major rubrics of our measures. And if you have any questions, now I know this is a recording presentation, but I would love to receive any questions or suggestions or any communication on my email that I would provide. So thank you for having me on this webinar, and I wish you a good continuation of this webinar. Thank you.
Thank you, Ms. Bourbar. After the presentation of Ms. Bourbar from Ramallah, we saw that their strategy is a great example of how solutions to new challenges can be aligned with already existing strategic paths for smart city development for a sustainable and resilient future for the citizens. Now we will proceed with our next speaker, Mr. Marc-Pascal Lerich, Head of Smart City Integration at Engineering ITS Germany. Actually, during the first installment of the Smart Health Responder webinar last year, Mr. Lanfranco Marasso, Smart City Program Director at Engineering Italy, participated with a very engaging presentation on data management in the COVID-19 pandemic. Today, we welcome Mr. Lerich with much anticipation in the light of the recent announcement from the European Union about the creation of digital green certificates to ease traveling within the EU community. Mr. Lerich will give us a glimpse of how digital technology can be utilized to aid tourism and traveling in densely populated urban areas. Mr. Lerich, you may proceed with the presentation.
Okay, so today I would like to present you a short overview about the future of smart tourism and how we would like to support cities to reopen during to the next normal their city centers by using digital technology. So next slide, please. So since more or less 1 year, we are facing the challenge of the coronavirus all over the world. So beside the critical healthcare situation, also our local economy, as well as the whole touristic industry are in a very, very poor situation. City centers and local stores are closed, and the traveling underlies strong regulations. Next slide, please. The challenge here is to reopen our cities under the perspective of a next normal. So that means under the strategic regulations and solutions that help to avoid new infections and that enable to start our public life again. So for this challenge, we would like to foster cities by providing a digital framework solution that works under the perspective of a smart tourism. Next slide, please. So therefore, I would like to present you the story of the city of Bamberg. So Bamberg is a beautiful mid-sized city with around 80,000 residents and an historical city architecture here in Germany in the federal state of Bavaria. So next slide, please. Around 800,000 visitors, that means tourists, visits Bamberg in 2019. So due to the Corona impact in 2020, just 40% were able to visit the city. Next slide, please. So that amount of visitors, I think, shows pretty clear the potential of the tourism. But on the other hand, it shows also the need of a mechanism that helps to control the reopening and that helps to avoid overcrowding as we see it on the image. So together with the city of Bamberg, we are focusing this challenge last year during the International Solution for City contest. And together we built a concept for a digital solution that includes the heterogeneous stakeholders inside the city. That means from the residents over the tourists, from the digital natives until the digital immigrants, as well as the city management and for sure the local economy. So with this concept we built here, we were in this context selected as the best solution for resilient city development. Next slide, please. Okay, so let's have a look how we can support them. I think one key element to reopen our cities and to enable the tourism is to have an overview about the amount of people who are moving actually through our city. Next, please. So therefore, we provide a solution that is able to detect the number of visitors by using Internet of Things technologies. That means Internet of Things sensors. Here are a couple of technologies in place, from laser measurements over radar measurements, Bluetooth and Wi-Fi sniffer measurements, as well as different network technologies. So for example, 4G, 5G, LoRaWAN, or some other established network technologies. But however you will detect in which technology you will use. Next slide, please. We use this data by implementing a data and a service platform that is powered by the open source components of the 5 framework. Sorry, I have again this Russian speaker in my head. Okay, so by implementing a data and service platform that is powered by the open source components of the 5 framework, we gather all this information and use this kind of information, which is sent from the IoT systems, as well as other informations from the city. So here one example, informations about our local stores, our restaurants, information from point of interest or mobility or environmental data and so on. So all this information will be used now for building so-called smart services. Next slide, please. So one example here for a smart service is an individual routing by consideration of the amount of people detecting by the sensors. So next slide, please. So to achieve all the stakeholders I mentioned before, so the information and services we will build will be provided in interactive mobile applications, web portals, or screens. Next slide, please. So to make it more visible, I bring you one example colleagues of mine built for the city of Antwerp. My colleagues built a culture app for Antwerp that allows the tourist, for example, here, that allows to select their tour highlights when they move to the city. Next slide. On an interactive map, they will find a different point of interest, and these different point of interest, as mentioned before, could be, for example, what's the amount of people now in my district, in my city district, or what is the next point of interest next to me, and what are the specific information the point of interest will be provided to me. Next slide, please. The smart service I mentioned in the slide before of the individual routing does not only calculate from A to B directly in the shortest lane. So this means that it will calculate based on the data we have in our system. That means if the system recognizes that there's a district within a huge amount of people, the routing is intelligent to move, for example, a little bit lower to avoiding an overcrowding here in this place. Okay, next slide, please. So by using this system, I think we have some benefits. So the first benefit, I think you can interact with the stakeholders of the city, with the tourists, with the residents, and provide them a digital solution for smart movement inside our city. So the next benefit here for the city management especially is that they can recognize where are bottlenecks inside the city. Bottlenecks where they can control the visitor flows, where they can build some solutions to avoid this overcrowding, and at the end of the day to help to reopen the city step by step, to reopen it really safe. Okay, next slide, please. I think furthermore, what we can do here is we saw now one example of smart tourism. So I present a short service of an individual routing. But I think if we are looking on the development of a smart city, we can achieve some more benefits here. So I mentioned that we are using an open source data and service platform that is able to connect several types of informations who are existing in our cities. So as you see on the graphic below, there are a lot of information from the mobility sector, energy sector, environmental and sustainability sectors. And all this information can be used to build smart services, to provide this data on a central data marketplace. And at the end of the day, for sure, to help to build your smart city network, and helps the development of new technology. And as the first speaker said very correctly, smart services for citizens are really important. Okay, next slide, please. So who we are the engineering company. We are part of a global company structure all over the world. We are around about 12,000 employees. Here in Germany, we are a bit smaller with 300 employees. But with smart city projects all over the world, I think we have a good understanding about the topic here. And I would be happy if you have any questions later on, or if I can tell you something more about our other smart city projects. Next slide, please. So from this case, I would be happy if you contact me via email, telephone, or via the social media channels. Thank you very much.
Thank you so much, Mr. Lerich. I'm sure that all of us are waiting for the moment where tourism is going to be a little bit more active and maybe resemble the situation before the virus, but we'll see. I know that from tomorrow, you're also celebrating Easter in Germany, and we know that there was supposed to be a lockdown, but it was lifted, thankfully. So I wish you happy celebrations also. And thank you once again for the presentation.
Thank you very much.
Our final presenter in session 1 is an inspiring medical professional, entrepreneur, and advocate for innovation and sustainability. Dr. Funmi Adawara is the founder and CEO of Mobi Health International and is working hard to promote innovation in digital healthcare and telemedicine while pursuing the achievement of UN SDGs. Dr. Adawara is passionate to change the poor narrative of Africa's healthcare landscape by leveraging information technology. It is my pleasure to welcome you, Dr. Adawara. We are eager to learn more about the rise of telemedicine in Africa and what solutions you foresee in the future. Thank you, and you may have the floor.
Good morning, ladies and gentlemen. I'm very honored to be here. Thank you for the opportunity.
Большое спасибо.
Next slide, please. So COVID-19 pandemic has really catalyzed the adoption of digital health technologies around the world. And although lots of attention has been given to the exponential growth in Western countries, but Africa and Africans are warming up to the adoption of digital health technologies. Given the peculiarity of our situation, you're all very well familiar with the various challenges that people face trying to access healthcare. Before COVID-19 pandemic, millions of people have to travel long distances to access healthcare with exposure to counterfeit medicines and significant out-of-pocket payment as a result of 95% of people not having basic health insurance. So telemedicine was a lifesaver during the pandemic because billions of
Как мы увидели, пандемия
because of the long distance they had to travel, but because in Africa bears 55% of the global disease burden, but we have massive shortage of doctors. Africa bears 25% of the global disease burden, but has only 2% of more doctors. And this is compounded by the fact that most doctors and medical professionals who train in Africa leave the continent in search of greener pasture. Next slide, please. So this just depicts the reality on ground in Africa. We have
Пожалуйста, посмотрите на нашу реальность, о том, что происходит в Африке на сегодняшний день. Телемедицина, цифровые медицинские решения и средства.
Ethiopia has about 3,000 to 150 million people. So this is a universal problem for the continent. Next slide, please. Next slide, please. Regardless of these challenges, Africa is a very ripe market for, before that, please. Africa is a ripe market for digital health technologies, and this is where the impact of the interventions can be felt the greatest. The slide before this, it presents a massive opportunity because about 3/4, this slide is about 500 million people have access to mobile technology. There's been explosive adoption of mobile technologies, over 500 million mobile users with 90% mobile penetration in some countries. 30% of the population, or 1.3 billion people, use smart technologies, smartphones. So it presents a unique opportunity for the adoption of telemedicine and digital health. We have seen a massive growth of the global telemedicine market, reaching about $130 billion. That was the estimation before COVID-19. And with COVID, this has increased significantly, growing at a CAGR of about 22.5%. The Africa and Middle East will account for 5.4 billion of that market. So Africa is not lacking in the innovation of digital health technologies. We have over 40,000 applications being developed across the continent for addressing medication delivery, from medication apps to counterfeit detector that's been developed by an innovative company called RxAll. We have Pillar Box, which is a smart medicine dispensary locker to reduce the waiting time for dispensing medication, especially for those who have chronic diseases. We also have remote care apps, such as the one we have developed, which enables people to access medical care. We have Omomi, which is a pregnancy app as well, that helps women to keep up to date with their appointment, antenatal care, and reduces maternal morbidity and mortality. Importantly, also, we have seen exponential adoption being facilitated by point-of-care testing tools, such as the point-of-care ultrasound that has been developed, and this can help to in places where you have no access to doctors and no laboratories or diagnostic centers. You can easily plug this into your smartphone or app or tablet, and you can carry out a consultation. You can do a scan of a pregnant woman, heart screening, heart disease screening. So the exponential growth of digital health technologies is facilitating and fast-tracking the adoption of telemedicine across the continent. Next slide, please. So artificial intelligence is the new norm, it's the new nervous system of healthcare delivery. It will help us to gather the data that we all know that there is paucity of data in Africa. And what technology presents is the opportunity for us to mine this data and learn about consumer behaviors that will help us develop solutions for preventative medicine. As previous speaker has spoken, investment in preventative medicine is a smart investment because, of course, prevention is more cost effective than treatment. Also, we have the adoption of wearable devices for measuring blood pressure, for measuring saturation of oxygen, and we have seen that being invaluable use during COVID-19, where we had to adopt for monitoring of patients who had COVID symptoms, and also for patients who had chronic diseases such as diabetes and hypertension. And so telemedicine is a new reality, and it's going to continue this way post-COVID because it presents opportunity to harness the global medical community to help to bridge the supply gap, for instance, in Africa. We as a company, next slide, please. We as a company have developed an integrated solution that speaks the narrative of the African market. Next slide, please. So we have developed a fully integrated telemedicine portal, which serves as a one-stop solution.
В Нигерии полностью интегрированный телемедицинский портал.
So through our app, which is present on the App Store, Mobile Health Consult, a user in Africa can now access a doctor, not just locally, but also internationally. And it helps to bridge this supply gap when it comes to the shortage of doctors and healthcare professionals. It's a smart app that has the medical record, electronic medical record. It also has the point of care testing device that is integrated into it for the measurement of vital signs, but also beyond that, that you can also replicate a complete physical examination. At the early onset of the adoption of telemedicine, one of the barriers to adoption actually was the lack of physical examination devices and point of care testing tools. So technology is now enabling that, and we can now monitor your vital sign remotely. Doctor can check your heart sound, can see, can do a full examination, including ear examination, throat examination of the child, bringing the doctor straight to your room. So telemedicine can help to resolve more than 60% of medical problems and strengthen primary healthcare, secondary healthcare, and tertiary healthcare. So our doctors are able to use the portal to do consultation, generate prescription, do diagnostic tests, and also to refer and do home monitoring and home management. One of the ways that we have been able to use this technology again is to help support the national pandemic response. Next slide, please. So we immediately launched the online screening tool that enabled the patient to access doctors, and also we use that to support COVID testing because we realized that many people were scared of going to the centers. And we partnered with a local federal agency, the Nigerian Institute of Medical Research, and we piloted the use of self-swab, tele-guided self-swab tests. And this fast-tracked the testing and reduced the test turnaround time of results. It also reduced the need to go to the test centers, exposure to COVID-19, and reduced the PPE consumption significantly. The platform is accessible through 3 different channels: the smartphone for those who have smartphones, and then we have toll-free lines for those who have just normal feature phones. They can call in and speak to a doctor in their language. Then we have the telehealth clinic smart solution, which comes with solar power and SATCOM and can be deployed to anywhere. So this can be deployed as a modular unit, or it can be integrated into existing infrastructure. Patient can walk in there, get connected on the phone or on the screen to a doctor anywhere in the world, and then they can get their physical examination done through the smart devices, with a doctor monitoring that remotely and giving the intervention that is needed. All this data is saved on the mobile app and is accessible also to the patient in a secure, HIPAA-compliant platform. Next slide, please.
Thank you, Dr. Adawara. I think we can sum up quickly. Okay. So I'm going to give you some time to sum up, and maybe, yes. Thank you.
So these are the advantages of course, of telemedicine, that it can help to expedite access to healthcare. It can help to reduce the turnaround time for results, and also help with treatment adherence. But it does come with challenges. Next slide. And some of the challenges that we have faced is the lack of cohesive digital health policy around digital technology adoption in Africa. Next slide, please. So the lack of cohesive digital health technology means that people, it reduced the investment in health technologies, particularly in Africa. So there's a need for governance structure. There's a need for the government buy-in in order to be able to drive technologies like this to the last mile. Next slide, please. And that concludes my presentation. Thank you.
Thank you very much, Dr. Adawara. And it's definitely sure that telemedicine is on the rise, and it will continue to be on the rise after the pandemic as well. So that was very useful insight from you. Thank you so much. And with this, I would like to close the first session of today's webinar. Thank you to all the speakers once again. Right now, my colleagues are also sharing in the group chat the link to the webinar post-event survey in the chat box. So you can fill that after the end of the webinar to give us your feedback on today's event and help us improve our activities in the future. Once again, apologies for the interference that we had, but we'll make sure that all of the presentation materials are shared with you after the webinar so that you can access them once again. Now, allow me to invite you to the opening of session 2 of today's webinar, dedicated to solutions for a COVID-19 free environment. Our speakers are committed to improving the quality of the surroundings we live in. According to a lot of scientific studies, there is a connection between the state of our surroundings and transmission of the coronavirus. Both of the solutions that will be shared today are also labeled and certified by WeGO's institutional member, the Solar Impulse Foundation, as 2 of their 1,000 profitable solutions to protect the environment. Let us welcome them. First, we will have Mr. Robert Heinecke, CEO at Breeze Technologies. As one of our very active WeGO corporate members, their solutions have already been recognized at renowned international competitions for innovation and sustainability and are regarded as a German industry leader in air quality sensors, data, and analytics. Mr. Heinecke will help us understand the relationship between COVID-19 and air quality and how we can mitigate the spread of the virus with digital technology. Robert, if you can hear us, you can have the floor.
Thank you, Todor. It's great to be here. Thank you very much for the invitation. Yes, hello everybody. My name is Robert Heinecke. I'm the founder and CEO of Breeze Technologies, and in the next couple of minutes, I'm very happy to tell you a bit on our insights in the connection of coronavirus spread risk, coronavirus mortality, and air quality in general. Next slide, please. As you already heard, Breeze Technologies is a German startup company. We're based in Hamburg, Germany, with our head office. We also have a smaller presence nowadays in Copenhagen in Denmark. We're a team of 15 people, and since 2015, we're working on air quality applications. We are very happy to also be a Microsoft partner. We have a couple of other international partnerships in the pipeline. And as of today, we're streaming from around 13,500 data points worldwide, real-time data, which gives us a unique insight into global air quality data sets. Next slide, please. And I want to take you on a brief journey. If you imagine yourself being in this kind of surrounding, what are the first associations that are coming to you? For me, it is definitely a nice, fresh, clean air that I'm breathing here. If I see this picture, I can really already smell how forests smell like. But unfortunately, that's not the reality for most of us in our daily lives. Next slide, please. It's more looking like this, right? Our offices are in downtown areas of cities. We are also mostly living in downtown areas of cities. So of course, we have a couple of different sources of pollution that we have to deal with in our local life. Next slide, please. And that leads to health issues, that leads to concentration and productivity issues, that leads to general well-being issues. Because when we talk about human needs, next slide, please, we have this traditional pyramid of human needs, right? Of self-actualization, recognition, sociality, safety, physiological needs. But what we often forget are the 10,000 liters of air that every adult is breathing per day. And this clean and breathable air is really at the foundation of what every human needs every day. Next slide, please. And all the more baffling is how we have looked at our buildings so far. So we had this big movement in the 1960s where we tried to get as many people as possible into our buildings with cubicles, with space efficiency. After we realized that that doesn't really work, we tried with energy efficiency in the 90s. We tried to isolate our buildings more and more. And in doing so, we sealed them so much off from their surroundings that there's actually little to no air exchange happening anymore. And this leads to its own complete host of problems. And this is why today, 30% of new and renovated buildings are facing issues with the sick building syndrome and with excessive complaints in regards to indoor air quality. And this is also the reason why today's building standards like WELL, RESET, and a couple of others are also focusing on environmental standards, on indoor air quality standards, to create a comfortable and a livable surrounding for the space users. Next slide, please. Air quality and the air that we are breathing is really very much connected to our overall bodily health and well-being. There are a couple of different pollutants that we're talking about, like particulates, ozone, nitric oxides, and so on, and they really have a big overall impact into our system. But even more than that, next slide, please, there is a link between air pollution and coronavirus spread risk and mortality. So on the one side, increased levels of air pollution in general are suspected to increase coronavirus mortality. There are a couple of recent scientific studies on that. So in areas with higher air pollution, there's a higher coronavirus mortality that's being observed. On the other side, also particulate matter and other aerosols in the air are suspected to be viral vectors. So the viruses are attaching themselves to the particulates and then traveling with them to the air, which leads to them also being more infectious in the end. And what that means is basically that you can look at air quality as also an indicator of COVID spread risk and COVID mortality risk. And of course, you want to improve air quality then to also improve these other factors. Next slide, please. And because of these guidelines, there has recently been some discussion in Germany on indoor air quality standards. And our Commission on Work Safety and Work Health came up with new standards on ventilation and work protection. And they have basically decided that you need to keep the CO2 concentration under 1,000 parts per million in indoor spaces to mitigate COVID risk to an acceptable level. And this is, of course, CO2 is, of course, connected to also traces of human breath. So by observing the CO2 concentration, you can see how much human breath is in the air and then how much potentially contaminated particulates are in the air. So by observing indoor air quality, we can, next slide, please, turn our buildings finally more healthily and create more comfortable and hopefully also greener spaces for everybody in our cities. And I think it is summed up nicely. Next slide, please, with this sentence. So by increasing indoor and also outdoor air quality, you can increase the health, the well-being, the productivity of colleagues, of employees, of citizens. And I think this is really important for all of us. Next slide, please. So what we have been doing at Breeze Technologies now since more than 6 years is developing air quality sensors, cloud applications to analyze this data in real time, and also recommending cleaner actions to build upon that. I will come to a couple of projects that we have done in the past in a couple of seconds. And in regards to our sensors, we really look at all the different parameters. Next slide, please, that are coming in regards to air quality. So really everything that has a health impact. Next slide, please. And we provide a comprehensive plug-and-play suite with documentation of indoor COVID spread risk based on the observed parameters and a simple visualization that can also be understood by the space users, like on the tablet you see here. Next slide, please. Our customers typically put that up on screens in their offices, in their co-working spaces, in their lobbies, to also engage the space users on indoor air quality. Next slide, please. And how that typically looks like is that we deploy sensors throughout an office building and then observe the levels and work with facility management to improve the situation. Next slide, please. And of course, this is already live. So here are a couple of the customer logos that we are already working with. Next slide, please. I just want to mention one of the cases that we've been working on. So for instance, for the digital hub logistics, that's one of the digital hubs that is run by the German government to improve digitalization in Germany and associated initiatives. They're using our sensors to improve their COVID spread risk, mitigate their COVID spread risk in their shared offices. And by doing that, they were also able to keep that open now during the pandemic and allow users of these spaces to have a higher feeling of safety and comfort in these buildings. Another potential application that we've worked on is with E.ON. Next slide, please. So in their corporate headquarters, that's a big utility company. We also looked at air quality. Next slide, please. And with that, I conclude. Besides indoor air quality, of course, it's also important to look at urban air quality and other emission factors. We also do that as Breeze Technologies. So also the overall emission of, for instance, of particulate matter levels. We are looking at with our solutions. We run one of the largest air quality monitoring networks in the world with a couple of our city clients. And yeah, I would like to thank you very much for your attention.
Thank you, Robert, so much for joining the webinar today and sharing the solutions of Breeze Technologies with us. Without further ado, I would like to introduce our next presenter in this session, Mr. Jérôme Voya from Waterlux, the CEO of Waterlux. Their solutions are focused on water treatment and disinfection, which is also, of course, a baseline necessity for urban communities, but they also target local communities, many of them in remote areas where access to clean water is scarce and of vital importance. Water treatment also proves crucial when dealing with the COVID-19 pandemic in local communities. Mr. Voya, we would like to hear more about the relationship between water management and the COVID-19 response and some of the significant projects that you have been involved in. Just one note is that we're currently running a little bit late with the schedule, so let's keep it short so that we don't keep our participants for the panel discussion waiting. Thank you so much for understanding.
Thank you, Todor, and hello to everyone. So since I'm the last presenter, I'm trying to make it quite quick and efficient. I would like to introduce you the context of disinfection in the world. Next slide, please. So we are nowadays talking about more than 2 billion people lacking access to safe water, and also more than 4.5 billion people lacking safe management sanitations. Next slide, please. What we developed actually in-house is a solution of electrolysis that can convert water and salt into active chlorine. So basically, what we are doing is to start with the solution of water and salt, then to apply our technology, which is called water, and then to plug it into a source of energy. After roughly 2 hours of electrolysis, we end up with active chlorine, which is called sodium hypochlorite. Next slide, please. This sodium hypochlorite, basically active chlorine, is useful on the field in 2 specific contexts, either disinfection or safe water, as you can see on the screen. So in this presentation, we will have a focus on COVID-19, and I will later explain the precise purposes for disinfection especially. Next slide, please. Our range of product has 4 different sizes, basically all working on the same concept, but just differing on the different volumes and capacities. As Todor was saying as well, we have the Solar Impulse label. We are certified by scheme of WHO, and we are also Swiss-made. Next slide, please. Together with the devices, we also have a set of reagents able to measure the concentration of chlorine produced, also the residual chlorine in the drinking water, and the stabilization of the chlorine after production. Next, please. So we have 3 main markets that we are working with. So the first one is healthcare facilities, second one, water pipe systems, and also emergency relief. On the top of that, we are also working on the ground with social businesses, prisons, and schools. basically, if we are talking about this water technology, you have to understand that the purpose of it is to create chlorine on site and then to use it on the ground. So all the 6 areas that I was referring to are quite useful and most of the time lacking of local solutions. Next slide, please. Just to give you a very quick insight of the team, which is actually quite small. We have 5 team members. We have also 7 representatives on the ground covering an area of 9 countries. Next, please. So to highlight this focus on COVID-19, I would like to give a little bit more about the context, actually. Chlorine is useful for disinfection, but is not always available on the ground, actually. Basically, it can be an issue to access chlorine because of logistics, because of price, because of availability. Most of the time, actually, we are working in landlocked countries, in remote and isolated locations where the logistic is an issue, where the prices can go suddenly up very quickly and suddenly people cannot afford it anymore. So what we propose is a local solution where chlorine can be produced on site, where volumes can be adapted to the actual needs of the healthcare facilities in this context. It's really easy to operate, and people can definitely be trained very quickly and adapt the productions to their needs just as they wish and related to what they actually need. Next slide, please. It's always very much representative to show some of our projects. So here it's the case. For the COVID-19 response, we have deployed several projects thanks to local partners, and also thanks to the fundings of international organizations and national cooperations. So here you have 3 examples, for instance, in Chad, in Burkina Faso, and in Benin. So you will see that we have a very strong African focus in our activities. And basically in these 3 countries, we were always targeting healthcare facilities, most of the time, again, in isolated and remote areas, where having access to chlorine is an issue. And basically what we were bringing was first a diagnosis of the area and of the healthcare facilities available and operating in the area. Second, a phase of training the people and installing the technology. And then another phase of monitoring and evaluation of the project, of the devices, and of the knowledge of the people. Next, please. We are measuring what we do thanks to a digital tool, which is called mWater. So it allows us to have live data collected from where we are working and to have a constant link together with our local partners. So basically, we design here in Geneva, Switzerland, surveys for technicians on the ground to be able to deploy this survey and to collect the data live. So it allows us to have very accurate diagnosis and evaluations, and then to be very efficient in proposing solutions or readjusting projects live. Next, please.
Thank you, Jérôme. I think we can wrap up quickly.
Yeah, that was actually my last slide, just showing you a little bit who are our actual clients at the moment. And I think if we go to the next slide, it's the last one. Thank you very much.
Thank you so much too for sharing the solutions of Waterlux in local communities in remote areas. It's projects that certainly make a huge difference in the lives of people there. So a very worthwhile solution. Thank you so much. And with this, I would like to thank our speakers from session 2 and proceed with the panel discussion of today's webinar. Thank you for your patience since we're running a little bit late with time. But in the next 10 minutes, I would like to turn your gaze once again to the perspectives of cities, because we have some guest speakers who are going to be taking part here. I would like to invite our representatives from the WeGO Mediterranean Regional Office in Beyoğlu, Turkey, our representatives from the city of Tsuane, South Africa, and the technical secretary of RECI, the Spanish Network of Intelligent Cities. I would also like to especially welcome again Professor George Crooks, because he will facilitate the discussion. So Professor Crooks, if you hear me, thank you for your patience once again, and you may have the floor.
Great, thank you very much indeed. I mean, you've all heard from me, and I think you really want to hear from the members of the panel who are going to give a very short insight into the real challenges and opportunities facing cities and give you their personal experience. So without more ado, I'd like to invite Ms. Melis Kaplangi from the Regional Mediterranean Office of WeGO in Beyoğlu in Turkey to share her thoughts with us. Melis.
Thank you, Professor Crooks. Hello, this is Melis Kaplangi. I'm the head of Foreign Affairs of Beyoğlu Municipality in Istanbul, Turkey. And it's a great pleasure to have the opportunity to share our experiences with you. The year of 2020 has become a beginning of a new period of time after the COVID-19 pandemic broke out. And whenever the balance between life and death is distorted, mankind's worldview has been affected fundamentally. A health crisis may cause this balance to be disrupted. And this time we used to search global solutions to national dilemmas after COVID-19. And all the countries are trying to search out national solutions to a global dilemma. As being the municipality of Turkey's and Istanbul's most cosmopolitan district, we needed to be very careful about which actions must be taken, because Beyoğlu is a hub for tourism and culture, so it was going to be affected by the virus faster. I believe that it's only possible by fast and accurate decision making. And that's why we gathered various parties together to work in coordination as a team. First of all, we implemented strictly the Ministry of Health's social sciences board's restrictions to stop the spread of the virus. The international and domestic flights were suspended, borders were closed. We switched to distance learning, distance working time to time. We had and are still having lockdowns. What matters most in our situation is rapid implementations, sustainability, and making the people gain the habit of keeping the social distance and hygienic precautions. Virus spreads fast, but its speed cannot exceed the speed of information. For this reason, we set a separate course of action, announcing measures to be taken and suggestions from health units to the citizens. We created special units, knocking every single door to provide supplies for people over age of 65 who were not allowed to leave their houses. During the pandemic, online services become crucial tools for our lives. Cities that starting building smart city capabilities have been able to use their solutions to better sense and manage their cities virtually during the pandemic. Our municipal digital platform, Smart Beyoğlu application, which we gathered all the services and information in a single digital platform, started to be used more during the pandemic. Through our Smart Beyoğlu app, all the citizens, shop owners, are able to reach the municipality easier and did all their interactions via their phones, because it was safer and more comfortable to pay their taxes online, for example, or to reach related employees directly through the app when it's needed. And therefore, it's strengthened the bond between local governments, businesses, and citizens. Moreover, our government created a mobile app called Life Fits Home. The app allows you to have information about the health status of people near you through the e-governmental health services. And plus, when you're entering to a place, it can be a governmental institution, a restaurant, or a supermarket, you need to scan your app barcode for being able to go in so that they will know about your health status. Local governments are respondents to the people who get in touch with the state through their cities. After the pandemic, this conventional role has gained even more importance. As the state, As the state is responsible for citizens, both medical and most basic needs, we are intermediaries between the state and the people, particularly during crisis situations such as we are all in these days. People will know that they can rely on their state as long as their voice is heard. Providing the chain of trust for this agreement is the main barrier of the epidemic's destruction of the dynamics of society. We act with this awareness. I'm summing up. The pandemic showed us that governance is as important as management, because there is no situation that can show the macro results of the fluctuation in micro scale more clearly and plainly. A new perspective must be established in order to act jointly and to reduce the time period between decision-making and implementation. Every single experience is being accumulated. It will pave the way to deal with the pandemic as long as we exchange experiences. Virtual summits, social media applications, transparency of applications will provide us with a roadmap for this experience sharing. We believe it's an advantage to be able to exchange information and experience with various missions, enabling us to enrich our knowledge with their experience, to transform the local experience into a global experience and share them with all to contribute to our mutual challenge against the pandemic. Therefore, we support any feasible initiative that will increase the possibilities of international cooperation. Thank you very much for your attention.
Great, thanks very much, Melissa. There's an awful lot in what we said in a very short period of time, and we might, depending how we get on over the next couple of presenters, touch again on that issue of trust, which I think is really important in a relationship between local government and its citizens. Can we move on now? We're going to hear the perspective from the city of Tshwane in South Africa. According to your agenda, we were expecting Mr. Justice Ratu Petsiani to join us, but unfortunately, I think he's had a family emergency and is unable to be with us today. So I'd like to invite his colleague, Mr. Lavi Pule, to take to the floor. Mr. Pule.
Thank you very much. City of Tshwane, firstly, I'm going to talk about the COVID and how the city responded. The first case in City of Tshwane was on the 11th of March 2020. And then the City of Tshwane has got 3.7 million people with 107 wards. 107 wards are the smaller portions of the city just to make it easy to manage. So as of the 29th, the City of Tshwane has got 109,000 cases, and then with 105 recoveries, which makes 97%. Now the issue is, how do we respond to this case? So the City of Tshwane has developed a ward-based battle plan. So we look at the cases in a certain area, we analyze those cases, and then the city has got a mobile truck that has got 3 consulting rooms. So the team go to this area where there are more cases, and then we screen the people, and then we test them on the spot. So we have a team, we call them a ward-based outreach team. Those are the people that are in the area that the city is going to, and those are the people that assist with the mobilization, assist with the education of the community. The truck will conduct the testing, whereas the foot soldiers, those are the teams, they go into the community to educate the community about the COVID, to identify those with the symptoms and refer them to the truck. But now in terms of the testing, for now, as a City of Tshwane falls under National Department of Health for South Africa, we have 3 phases that we are introducing the vaccines. The first phase is for healthcare workers, which started in February 2021. So the second phase is going to be for essential workers. The third phase, the second phase is essential workers and 18 years and above with comorbidities and everybody who is 60 years and above. And then the third phase is where we are going to target everybody from 18 years and above who is not reached with the previous phases. So the system is going to work like this. All our healthcare facilities are going to continue to vaccinate those people who will be going to the clinic for follow-up of their chronic medications, because those people are people with the comorbidities. And then the city has also developed a clustering system where we move either to a community hall or a church per arrangement. Then we reach those community members who are in those communities. We advise, we request them to come to the site to register, and then we'll be having a team there to administer the vaccination to them. At the moment, we have 281 vaccinators for public sector, and we've got 36 vaccinators for private sector. So the total number of sites that will be offering the vaccinations, which are medically inclined, is 83 in City of Tshwane, and the others, we call them non-medical sites. Those are the community halls, the churches, and so on. So the City of Tshwane is not working alone. We're having partners in health centers like Crooks, like Discom, MediRite, those pharmacies. We've got a relationship with them. They will get the vaccines, and then they will assist to vaccinate our community members who are going to them, who are collecting medication from their side. So the targeted population is as follows. So for the phase 1, we're targeting to reach 77,000 healthcare workers. This includes both private and public. And phase 2, we're targeting 1,081,000. Phase 3, we're targeting 1.4 million individuals. So the phase 2 is going to start. We're waiting for National Department of Health South Africa to indicate the dates. But up to now, the date looks like it's going to be in May, because in April, we're still preparing, registering our people so that they can be registered and they can receive the vaccines. The healthcare workers that we have vaccinated as of yesterday is only in Tshwane is 21,891. So that is both for public and for private sector. And then in terms of reaching out to the communities now, we're looking at extensively reaching out to the hard to reach areas. City of Tshwane has got both rural and semi and urban areas. So the rural will target those, because those are the people that when they are having the COVID or the coronavirus may suffer most and may spread the disease to other communities. The prevention strategies, we are going to continue with it, emphasize with it, like wearing of mask and proper wearing of mask, covering both mouth and the nose, and the social distancing, regular hand wash, and when people are sick, we encourage them not to go to the facility, because the district has got what we call contact tracing team. For those who are positive for COVID, we follow up their contacts. For those who develop symptoms at home, we go to their homes to go and collect a sample from them. Thank you very much.
Okay, thank you, Mr. Pooley. Very, very interesting, and not insignificant challenges ahead as you try to get your vaccination program across as much of the population as you can. Finally, in this section, I'd like to invite Mr. Francisco Javi Perez from RECI in Spain to give us a bit of an insight into answering the question, how do we ensure safe traveling and movement of citizens? Francisco.
Thank you very much, Dr. Crooks. I'm Javier Hidrojo from the Secretary General in the Spanish Network of Smart Cities, RECI, and also the Coordinator for Technology Modernization, Economic Development, and Professional Knowledge in the Municipality of Logroño. This network I belong to is a network with 119 cities. Thank you. The most populated cities of Spain are included in this network. We have more than 400 of cities, CTOs, CIOs, and as well as political representatives in this network. And our main objective is to learn from each other projects and experiences, exchanging good and bad practices. Other objectives include the promotion of efficient management of urban infrastructures, services, and foster the research and innovation in our cities using technology and improve the quality of life of our citizens in their talent and generate opportunities for them. We are organized in 3 working groups. The first one is the government, social innovation, and smart economy.
I'm sorry, Mr. Perez. I'm sorry that we would like to maybe continue with the challenges with the Corona-19 response. Since we don't have, I'm sorry to rush you, but we don't have much time. We have to wrap up quickly. Thank you so much.
Okay, thank you. Sorry. So health issues have been and still are the main problems to solve in Spain. But we usually in our cities doesn't have a lot of competencies in health infrastructures, but there are many things we can do. There are some examples of it as we can tell. For example, in social inclusion, during the first stage of pandemics, Spain citizens were locked in their homes, and there were some problems for all people that couldn't provide for themselves. Most cities provide the citizens with social platforms to help neighbors, where you could apply to help all people that needed to help to do different things like shopping or throw the garbage away, for example. And in the problem of health resources distribution, there are some examples. For example, in the first few months of the pandemic, there were not enough face masks for the population. Most of them were produced in China, and the whole world was competing for them, until many industries locally began to produce them. The governments made joint purchases for all the cities. When these purchases came to a city, they had to be delivered at the same time, and the logistics were very complicated. As the delivery of the face mask were crucial, according to different size of face masks and population around the delivery points, which were schools and sports centers, these logistics were in making for this logistic possible. Smart city platforms were fundamental because they had to cross data of the logistics needed in every part of the city with the age and population around them to distribute the sizes of the face masks. Another example of health resources distribution was to the delivery of ambulances to hospitals, because in some areas hospitals were flooded, and at the edge of collapse. So the real-time information to reroute these ambulances to the hospitals were crucial, because they couldn't upset more patients. And the flow control were some of the measures that were fundamental, because many cities have implemented flow control measures using sensors and cameras to control access to usually crowded spaces like beaches or public buildings. Many of these cities used artificial vision and widely used it to allow entrance and limit the number of people inside the premises. As well, another case of flow control was that active cases were monitored in different neighborhoods, so segregated cities restrict movements according to incidents of COVID-19 in the neighborhoods. As well, regarding the question made by George Crooks, Dr. Crooks, I think that is a COVID-19 passport, like the European Green Passport, should be widely used in several countries, and this could be the crucial measure to facilitate the traveling between countries and cities. But it has been too widely used, and the more countries using it is the better. Okay, so thank you.
Great, thank you very much for your intervention, Francisco. Clodagh, I'm very conscious of time, and I'm sure we probably don't have time for questions. If I can just sum up for 30 seconds and then hand over to yourselves for the closing session. There's a number of key messages that you've heard from the presenters. One of the most important one is about trust. it doesn't matter how good your policies are. It actually doesn't matter whether you legislate for people to behave in certain ways. It's down to the individual behavior of citizens, both complying to social distancing and other infection control measures, but also relying on citizens turning up for their vaccination. And a phrase that Melise said is one that's going to stay with me for ages, is information can travel faster than the disease. And on that basis, using digital tools and services appropriately can make a real difference for us all. Thank you very much to the contributors for this session. Todor, over to yourself.
Thank you so much, Professor Crooks, and thank you to our participants in the panel discussion for the insights on the situations in their cities and regions. With this, allow me to wrap up today's webinar, and in the words of our Secretary General, Mr. Kyung-Yeon Lee, the 3 Ps, precaution, prevention, and preparation, are key in this situation. In 2021, fighting the COVID-19 pandemic goes hand in hand with intense preparation, as it is crucial that we prepare for the future and for the next normal. Local governments, corporations, and stakeholders in Europe, the Middle East, and Africa are a testament to this steadfast process of preparation, which paves the path to sustainability and resilience. To all of you who joined us today, we would appreciate if you fill the post-event survey form to express your feedback on the event, but also to share with you any questions you might have for the speakers from today's webinar. We'll make sure to send them to the speakers. Thank you so much. And finally, you can see a slide on the presentation which shows the range of activities that WeGO will be engaged in throughout this year. And as you can see, a follow-up WeGO Smart Health related event in July is currently in the works. The Smart Health Responder workshop for joint expansion with partners plans to gather global experts and professionals in the health sector to explore ideas about expanding the functionality of the Smart Health Responder by developing an open data platform. If you're a partner interested in taking part in this initiative, kindly reflect your interest in the post-event survey form and contact us directly at the WeGO Secretariat. I think that today's webinar was a very strong basis on which these partnerships can develop also in the future. And once again, I want to thank everybody, including our speakers and participants today, for joining us, for staying with us until the end, and for your patience. Thank you so much, and we look forward to seeing you again very soon, virtually or in person. Thank you, and have a pleasant rest of the day. Goodbye.